what led you to go down the route of medicine?
So I actually started my academic career as an engineer. Then I quickly realized you can talk to a computer, but it will not talk back in those days. Today's very different. And I really missed interaction with people. As I don't know if I should say these things. I was going to say, as an Indian person, you only have two career choices, engineering or medicine. So I went the medicine angle, but as I was going through medical school, that's when my passion for taking care of people really came to light. And I really understood that I enjoy taking care of people sometimes when they're at their most vulnerable. Which led me to a career in heart failure. I could actually help a person who has lost a lot of hope and belief that they have a tomorrow and give them an opportunity. So Andy, what started your career in medicine?
Well, my father was actually an Emory trained cardiologist, and I was able to observe him working in Tallahassee, Florida, and just loved the interaction that I saw that he had with his patients.
What advice would you give a student rotating with you on our service?
I think the most important thing is just to be curious, to ask questions of why things are, and to know that there's not like a set pathway that's out there, and that I think we all went through as we had great respect for seniority, but over time you learn that hey, the most senior people don't have all the answers, and to remain curious about what those answers are.
I thought you had all the answers.
Right.
I think for students, very often I get approached by female students, I'll be very honest. They tend to ask, about life and career choices. And so I tell them I have 2 young kids, I'm married, I have a husband, he's also a physician. The most important thing to, I think, feel accomplished and feel successful is to follow your passions. And if you really enjoy caring for patients, well, number one, don't finish medical school if you do not enjoy caring for other people. Like, get out now, do something else. I do not feel you can be successful unless you really enjoy the patient care aspect of medicine. And then follow your passions. My personal feeling is if you do what you really love and the rest of it falls into place, you're a happier person, you feel fulfilled, and your family and everybody else will understand that, and it all comes together.
Also to realize the things that you're good at. Pursue those things, don't necessarily work super hard on the area that you're struggling in. I remember asking one of my attendings, can you teach me vectors on EKG? He goes, yeah, I can teach you that, but it's a lot of work and it's probably not worth it. So I was like, great, Dr. Warner saved me a few months of my career. I think everybody has special traits, and that's another thing that I like about our cardiology group, our heart failure group, is that we have people who develop true expertise in specific areas, and that we can go to and ask questions and rely on, and there's a lot of people who are experts.